In 2011, the Minnesota State Legislature, in response to significant organizing by advocates and survivors, passed the Safe Harbor Law. This law recognizes that young people who are sexually exploited under the age of 18 should not be treated as criminals, but rather as victims and survivors in need of trauma-informed, wraparound services and support. Minnesota is unique in that it centers its response on a public health approach while partnering with other systems, including public safety and human services. The public health lens focuses on several key concepts, including improving health and racial equity, applying harm reduction models, and basing solutions on population needs identified through data analysis. Over the years, the Safe Harbor response has expanded to include services for youth through age 24. Through federal and state funding, Minnesota has also built a labor trafficking and exploitation services response, serving people of all ages. Through research efforts like Safe Harbor for All, it's hoped that one day the state's services funding will also reach survivors of sex trafficking over age 24.
Sometimes I give my story because that's the only way I know how. Other times we're doing trainings, things like that. But the main thing is to just give what I know, my experience.
In my role at MCRC, we see young people from birth to 18 who have experienced various forms of child abuse. So that can include physical abuse, sexual abuse, as well as sexual exploitation. We know that the vast majority of people who experience exploitation do come in contact with the medical system at some point during the active phase of exploitation. And I think it's really important for healthcare workers to be screening and anticipating that they will work with people experiencing or having survived exploitation, and to create a space where when someone is able to or ready to disclose that they're ready, but also a space where they're able to receive services even if they're not ready for that, so that tomorrow or next week or next month they also feel safe coming back when they may be ready. They feel that their immediate needs were met, and that this is a place that they could return to even if today is not the day.
Some have been trying to get out, and every time they try to get out, the system say, hey, I got your back, and then flip their back and say, you did this wrong, this. Why would I come back to a place being judged when I was okay where I was?
In the healthcare setting, there can be some indicators of exploitation. Who is with a person who has brought them in, chronic neglect of basic health, dental care, frequent STIs, multiple pregnancies or multiple pregnancy terminations, evidence of branding or a tattoo that someone has received. Sort of really looking at things that seem new, seem to have a high cost associated with them. Clothing that seems very inappropriate for the weather, people who have lost dramatic amounts of weight, and people who are experiencing mental health crises are going to be more vulnerable. If someone comes into a healthcare setting that I'm working in, regardless of who is with them, I'm going to insist on some time one-on-one with that person. It's absolutely a policy. I have to insist upon it. I'm so sorry. Here's where you can go. Here's what you could do. I hope you understand. Oh my gosh, you wouldn't want me to get in trouble with my boss, would you? Whatever technique you have to use, but spending some time one-on-one with a person that you're working with is critical.
If you do not know where that child comes from or what they come from, you'll never understand. And sometimes you kind of have to just be there in their shoes.
Allowing young people to use their own voice and tell their own story when they've experienced or we suspect they've experienced exploitation, I think is very important. And part of my role as a medical provider when I am taking that initial history is looking at that young person's own language and mirroring that language back to them. And then sometimes, when there is trust or there's rapport that starts to build up, ideally over time, oftentimes it's not the first time you meet with someone, then you can start to do some additional sort of questions, see if you can kind of get them to talk to you more about, like, hey, the last time we met you were telling me about your boyfriend. Tell me more about that relationship. Tell me where you met. Tell me how long you've been together. Tell me how he treats you. How do you feel? And, just sort of start to help them tell their story is something that I think works to allow young people to take things at their own pace and receive services as they're comfortable. Anyone who is working with someone, whether personally or professionally, where they suspect exploitation might be going on, should think about what resources exist in their community. Here in Minnesota, because we do have the Safe Harbor Network, anyone can reach out to the regional navigators. So each of the counties is going to have someone assigned to answer questions about what resources are available. For those youth that are under 18, if you have evidence that they are being exploited, remembering to make that mandated child protection report, I think is important.
The most important thing to understand about youth being trafficked, I think, is understanding their story, or knowing that everybody is different. You cannot have a bias. You should not have a bias with anything.
It is really important for us to think about our own lives and to think about our own biases that we bring into the healthcare that we're performing, and then decide to leave all of that behind and realize that we're working with another human being who's coming in and trusting us with their most vulnerable moments in their lives. And it is, I think, incredibly critical to be non-judgmental in how you approach a patient that you are working with, especially around topics of sexual violence or sexual exploitation. If I'm going to do my very best to be non-judgmental about something like a pelvic infection, we're going to treat this, we're going to get you healthy. And I need to be ready to do that if I'm going to ask someone to tell me about their STI history, for instance. Health is a lot more than medical care. So that is one of the things that I really like about Safe Harbor, is that it gives me that ability to work with someone who's going to help a young person with housing, or is going to help a young person figure out their legal issues, or is going to provide ongoing case management or support in the community on a culturally specific basis. And all of that is going to provide health to a young person. So, while I might be the sort of medical provider who's seen you in the ER or seen you in the clinic, I'm really grateful to all of my colleagues who are helping really provide for a healthy future for the young people that we work with.